All right, we're good
All
now.
right. Thank you. Okay, so maybe Alice and Katie just repeat what you wanted to change for next time in the agenda. So Tina has that.
I commented that the notes correctly noted that Erica Jennajohn left Albemarle County DSS, and so she can be taken off the agenda as somebody who provides updates.
Great.
Yeah, so our FAP chair now is Ellen.
Yay, Ellen. Okay, so next on the agenda is evidence-based practices training and the CHINS work group. When I was reviewing the notes, it looked like there was maybe going to be a meeting in June, but I couldn't really tell if that occurred or not. So who would like to give the update there?
I think where we left it was we had asked if the school folks could maybe come to program. That was easier than coordinating a separate meeting, but I know a lot of them are off during the summer. So I think we had talked about waiting till school started again.
Okay, so more to come on that one.
Jody, should we start asking folks about that now or wait until school starts and I can send another email or folks checking email?
I mean, it's hit or miss, but they're back on the 15th. So
Okay.
it would probably be better to maybe wait just a little bit. The start of school is usually
Maybe they
a little hectic.
yeah, maybe they could come to the October meeting.
That would be great.
Okay, so that work group will be within program meeting and we'll hope to start in October. All right, fact updates. Ellen, this is you.
Let me find my unmute button. I do not think that we have any particular updates. I'm suddenly going, what am I supposed to be reporting on? I mean, we do have I guess we will be having a new private provider representative joining Albemarle FAPT coming up as soon as CPMT can officially approve them.
Yeah,
Other than that, I don't know.
same thing for the city. So our new FAT provider, private provider rep will be Cassandra Winfrey. She is Java? No?
Health Connect.
Thank you. Sorry, I was on vacation last week, so I'm still getting back into the swing of things, I feel like. So she will start, sounds like in August. Other than that, I don't know that we have much of an update.
And I can share that for Albemarle, it will be Dana Scott from NCG.
Rolling into CSA coordinator update. Anything new?
Yeah, so like I said, I was just wanting to make sure that the group knew that we would be going back to in-person for the October meeting. And then as soon as I can find the meeting room, I'll be sure to update folks for the September meeting to let you know where. And I'm trying to think if there's anything else. Katie, can you think of anything? The only thing big that's coming up is the private day, the tiered thing that's got to be sent in by the 15th. I think that's the big thing that's pressing right now.
So the state, you know, they've been talking about having standardized rates for private day schools for a while now. They did a study, they didn't have enough providers participate, so they were asked to do a study again. And so now there was legislation for it to happen this year. That's not going to happen. Instead, OCS has to do this cost analysis study for the private day schools. And so they're asking private day schools to put students on a tiered system. I think there's 9 different tiers based on, I think, things like student to staff ratio, the needs of the kids, those kinds of things.
Wait, so
And
does the private day would be labeled with this tier?
no, so the
No.
student would be placed on a
student.
tier.
Okay.
And then the private days are supposed to report that to the locality. So like for us, like Keys will need to give us a list of all of our Charlottesville kids and what tier they're on. And then I think the intention is next year, that tier will correspond to a certain rate that we would then pay.
And then who decides the tier?
My understanding is it's the private day school. I'm not clear about what role the school, the public school plays in that. So Jody or Ashley, I don't know if you guys know any more about that than we do. There's been one training for us. And we were kind of told like not to ask a lot of questions because things aren't really figured out. And this was supposed to start, what's today? Today's the 3rd, 2 days ago. So I haven't received anything from our private day schools yet. I'm not even clear if they would be sending it to me or the public schools, but considering that folks are also off for the summer, I'm not sure.
Was it like a tool? Are they using some tool?
Yeah, there's like there was like a tool created for them to help for them to fill out and send back. And yeah, and so we can't set up any purchase orders for private day schools without getting this information regarding which tier each student is on back from them.
How long will a student be on a tier? Is it for 30 days or 60 or 90? Are they tiering students weekly? Like, what does that look like?
Yeah, at what point can that be redetermined? Don't know.
I'll chat with the special ed side of the house to make sure we're on top of that.
Well, Patty
went to that training, right?
yeah, and so she might have some information she can pass along. I know I've talked with Kim about it just because Kim does funding, but if there are other folks that I'm not aware of that might need that information, again, I feel like, I'm not super clear on it.
I'll just make sure they're super clear, because
I don't know that anybody's going to be able to be super clear. But I think, it's the reason they set it up this way was to motivate providers to get it done so that they can get paid, because they can't get paid till they get it done, and provide us with the information.
Is there any possible dispute that would happen? Like, is it going to go to OCS and then OCS is going to say like, I don't think there's enough documentation, or?
So OCS was like, we don't want the list. The way that they get the information is when we set it up on a POSO. So they created a new standardized service name for these tiers, and that's how we report it to the state. That's the information they'll get. They won't really get any information about the particular kid. So.
Okay. Well, that's interesting.
But, again, I'm not clear on what if the public schools can say, no, we don't agree with that tier, or at what point, it would be time to reassess the kid and maybe they're on a different tier. Because I would assume that if the need is less or they need less support, that they would move down a tier, which means we would pay less. So we'll see how all this works out.
So with the OCS's push with evidence-based training and practice, is this evidence-based? Is this like something that like other places are doing?
I think it's the motivation was to control cost, because private day costs have just increased so much over the past several years.
All right, well, good luck with that. Interesting to see how it will play out. Any other updates from coordinators? Any partner agency updates?
I would say the Albemarle has three new supervisors. Kim Harris is supervising our family support program. She's been in child welfare for 22 years, the last 20 in Albemarle and the last 16 in senior worker roles. So she brings a really well-developed breadth of knowledge and skills to that role. And then in foster care, our I don't know, I think I can't remember. I probably didn't know if we were approving minutes for May, but I learned in June, one of our foster care supervisors was leaving at the end of June. So they did. And so we have a new foster care supervisor, John Kramer, which we're excited about. John has tons of 30 some years of experience in child welfare, and most of that is in foster care. And then finally, in our family preservation program, we have a new supervisory position to co-supervise with Megan Tretoka, and that's Jay Chowdhury is the new family preservation supervisor. So we've had lots of change at our leadership level, and then the only other noteworthy update probably for us is we continue to seek out qualified foster care workers to apply for our positions, because we're going to have two new folks starting in August, but we have two vacancies in addition to that, and then we just a third vacancy is going to be happening in September. So our foster care team is really, those who remain are really swamped, and their cases are well beyond the caseload levels, well beyond the state requirement of 15 cases. So if you know of any good people interested in that work, send them our way.
Any other updates?
I can share that Region 10 is, so for the Child and Family Case Management Program, or particularly for our High Fidelity Wraparound Program, we've added a new ICC clinician, Michael Wingate. We've also, in the outpatient program, been working with a new group of interns to try to increase capacity. And so hopefully there's some movement and less of a wait list. I don't know that there's any other particular updates at this point.
We have service provision during COVID. I wonder if we should just take that off, because I feel like it's just like Life Now or something. Like, I don't know that it's really going to be any different these days. We've, I think, adjusted. But what do you guys think? Should we keep that on there, or has that been helpful?
I think at this point it can come off.
I would agree.
So Tina, if you could take that off for our next agenda. You are guidance.
So I'm still in a holding pattern. So I still have one more high fidelity wraparound position I need to get filled before I feel like I can move forward with that. But I'm on the brink of hopefully doing that. So I'm hoping that I can start actually following through with doing the utilization review next month.
I'm wondering if we want to update our data set.
Probably at this point we might need to.
Yeah, so why don't Jennifer
Sorry about
and I
that.
work on that? No, why don't Jennifer and I work on that, and we can get some new cases to you. Roberta, yeah, why don't you tell us when you're ready, and then we'll get new cases to you.
That makes sense.
All right, our focus areas, we kind of, I guess we kind of do this, kind of don't do this, but does anybody have anything to report out? I guess we have a family engagement item, right, Jennifer, that you sent the survey. But does anybody have anything else for the focus areas?
So I was going to say the state sent out the service gap survey for like the statewide report. And I'd say it's pretty much across the state what we're seeing in our locality. I don't think there's a huge difference in what's going on everywhere with just staff shortages and a lack of resources and that kind of stuff. So we can definitely send that out to programs so that you guys can have that information. And then as far as the survey goes, so I sent out the FAPT survey, and you can see 4 out of 21. So, you know, again, the response rate remains pretty low versus when we were in person. We pretty much had 100% when we were meeting in person for FAPT, but now we mail those out. And so we can obviously see a pretty significant decline in the folks responding. The other thing that I wanted to bring to program is the provider satisfaction survey that we do. So it was due back to you guys last month for that final quarter of FY22, but there were no surveys completed for that entire quarter. So I actually followed up just to make sure the links were working or if something was going on. And so there's no problem with the links. It just, for whatever reason, we didn't have any responses. And so I guess it's worth bringing back here to the program to ask, is this the right way to try to get the information? Should we be doing it differently? Is there a different message that should go out to case managers on how to get folks? I don't know. So I'm just bringing it here to hear your thoughts about kind of next steps for how you guys want to do this.
And I think we were kind of worried this might happen is like in the beginning when it's new, folks would do it. And even then, I don't feel like the response rate was great. And then it kind of, you know, as it gets old, people forget about it or don't have time for it, or it becomes, you know, doesn't become a priority.
Anyone have any ideas?
I was wondering if perhaps doing a you know, at the end of FAPT, you know, when participants are present, we can sometimes sort of prompt people. I don't know if it would make sense to maybe add about some information or some reminder about that to the case managers and to the participant that may be coming or the family member that may be coming.
Or even like sending the email at the end of the staffing, but I mean,
Mm-hmm.
it's one more thing to have to remember to do during the meeting. But maybe if it's immediately following, I don't know. I mean, it would still have to go to the case manager, I think, to send, unless there is a family member attending.
So I also, just having some real talk, I think there's also the reality of what life has been like in the last 2+ years or whatever year we're at the moment. And I think if I put myself in the shoes of like my own shoes, I'm not gonna lie, if I got the survey, I'd be like, I don't have time for that. Like, that is not my problem. I'm not filling that out. And so I think it's like, I don't know how many surveys you get in the mail asking about something. I don't care if I'm getting it via email or mail or somebody's calling me. Like, I'm just like, that I'm not expending any of my energy filling this out. And so I do feel a little bit like, I'm just going to say this, like we're spitting in the wind at the moment. Like, people's energy to do things like this their bandwidth, my bandwidth is so small. And so I feel like we're spinning our wheels to try and get information that I'm not sure we're going to get. And I'm just going to say that because I feel like we're revisiting this every, I don't know, meeting that we have, and we keep coming back to maybe not the real conversation, which is people are exhausted about everything still. And we're trying to get out of a place of survival and into like, it's time to start thriving. And so I keep coming back to my bigger, like my own thought about, are we just asking people to do something that feels like too much at the moment? For what purpose? And maybe it's time to just nicely say to CPMT, we understand that you're asking us to get this data, but we've been trying and it's not working. And so we just need, like, here's the data that we have. We know it's like, it's 3, we have 3 surveys, but it's not for lack of trying. And we need to take a break for a moment and we can revisit it in whenever sick, you know what I mean? Like, I think it's time to, at least for my perspective, to stop banging our heads against the wall about this particular thing. Because I think our families are, like, they're not filling it out for a reason. And I don't think it's the questions we're asking. I don't think it's because it's coming in an email or a QR code or a text or an envelope in the mail. I think they're like, stop asking me, I'm tired and I'm not going to fill out that form right now.
Yeah, and I mean, there's no like motive. I mean, I'm the same way. Like, I don't fill out most of the surveys that I get unless there's some sort of personal motivation to do so.
And the survey came out of, it was essentially like a goal of CPMT, right? Or like,
So it comes because of the audit. It's a
Audit.
requirement of the OCS audit. So, and you know, we're in our current cycle of when we'll be coming due this year. So, you know, I think for as painful as it is, being able to say that we do it, there's value added for auditing purposes, you know, for actually informational purposes. I don't know that I would necessarily say there's huge value added.
Maybe it's a good message to OCS about this is an unrealistic expectation of your audit.
yeah, because the audit, we're not going to get like, I guess, I don't think we would, you know, they're not going to say like, you know, give us money back or something. You didn't get survey results, you know, but they're just going to want us to know that we have a process, right? So we have a process, we have a survey, we send it out. But like after that, can't really make people fill it out. So maybe continuing on and just kind of dealing with the lack of response, at least until the audit, which is when? Is it next spring?
So we haven't gotten their time frame for, I just know we're due this year. It's FY23.
And city and county, are we both like on the same schedule? I didn't think we always were.
We asked to do that
Um,
because it's just easier for us and easier for them, really.
Yeah.
I mean, I think survey results in general, like across research, are pretty, like when you send them out and you're expecting like a form back, it's pretty low. So I think, you know, maybe way in the future, you know, something that might be more helpful is something like a focus group or something like that. But that's not going to happen now. So just keep plugging along. Do we want to bring this up to CPMT or just let them know that we aren't getting any results from our survey?
Yeah, I mean, I think we can make them aware of it and say we're going to continue to do it so that we have a process. But at this point, it is what it is.
All right. Trauma-informed services report out or update. I know there's some CRI trainings that Region 10 is doing. So those that have new staff, I would encourage people to get their new employees, you know, a part of that training. I think when I looked at the list, it seemed like there was a lot.
Yeah, there's the CRI training series is, so it starts with CRI 1 and then before you can go to 2. And the next CRI 1 training is coming up this month, I believe. I can resend the flyer to this group.
There was some in September too, so.
Yeah, there's a progression, a series.
Any other updates? Any new business that we need to talk about?
So I was just going to bring up that Krista had said she can't chair for this upcoming year. So we are looking to folks to see if somebody would be willing to step up. I know CPMT, or at least for the county, we're having the same struggle of trying to identify a chair. And so it's likely going to be brought up, the suggestion of making a rotation so that folks each get a turn at the helm. So I don't know if that's something that you guys would want to consider or not, but I do know that we'll need a chair for program going forward.
Anyone want to volunteer now or?
I can do eeny, meeny, miny, mo with the squares on the Zoom, if you guys want me to.
We could play some game or see who can like put the clapping hands up first or something. The last person that does it loses. Well, I don't know what we're supposed to do if no one volunteers, right? So I don't mind doing it until we find someone, but I did it not that long ago. So I want to give, opportunity for others. All right, we'll talk about it in September then. I don't know what else to say about that. Message out to CPMT. Do we know if Chris is going to go to CPMT next? It's like in a couple weeks, right?
If not, I think Jennifer and I can message out anything important.
Okay, I appreciate
We
that.
can update them about the survey.
Yeah, the survey. I guess maybe you are guidance or plan around that.
So one question about the chair, besides like facilitating the meetings here, is there any other responsibility associated with it?
So you have to attend the CPMT meeting because you're a voting member of CPMT as the program chair.
And when does CPMT meet?
Right now, they meet the third Wednesday at 3:30 to 5, but they're looking to change their meeting date and time, likely to, I think, more than likely to be a morning time, but they haven't decided for sure yet.
Okay.
I think that means Alice is at least considering.
Absolutely, Jenny. Gotta give it some deep thought and reflection.
Good, good. We'll look to you next month for an update there. All right. Anything else for today? Well, thanks so much for everyone joining. Sorry about the hiccup at the beginning. Hopefully we'll just have to deal with that possibly one more time, but Katie's going to work on it so that it'll hopefully go smoother next time. And then it sounds like we'll look for information for, I guess, so that would be October to meet in person, and Jennifer's going to look for a space. All right, talk to you guys later.